Welcome to everyone. We're back after this short break to talk about all the topics that were treated and dealt with Serge, Morand, and Bernadette, Abela-Ridder. And we'll go much further, of course, thanks to this roundtable dedicated to knowledge development. Where are our knowledge gaps to implement a holistic and integrated public health? Just before giving you the floor, I remind you, to all of you, that you can book B2B meetings on the B2Match platform during the whole day today, whole day tomorrow until 6 o'clock p.m. tomorrow. You'll be able to get these B2B meetings. So remember that B2B meetings on the B2Match platform. So this roundtable with Julie Teresa Shapiro, member of the Department of Life Sciences at Ben-Gurion University of the Negev, then again with Bernadette Abela-Ridder from WHO and Serge from CIRAD. And we have two moderators to moderate this roundtable. Emmanuelle Gilot from your professor in veterinary epidemiology and wildlife health at VetAgro, and you have some research interests in analyzing and modeling postpartum dynamics on wildlife and livestock, and you're head of expertise group on wildlife health at EVAS. And Pascal Hudelet, you're graduate from the Lyon Vet School, and you're leading the technical service department of the Veterinary Public Health Center of Boehringer Ingelheim, and you have 20 years of experience in the animal health industry, leading the development of vaccines against blue tongue and foot and mouth disease, and supporting multiple countries in their infectious disease control programs. So now I give you the floor.
Okay, thank you very much, and good afternoon. Yes, this roundtable had a question about knowledge gaps. So where are the knowledge gaps to implement a holistic and integrated public health? So we thought about two large questions. The first is we need to implement relevant measures to prevent and to control infectious threats. But to define them, we need a corresponding strong knowledge and to use it and to translate it into skills and practices, as Serge said a moment ago. So we had, in fact, two big questions. The first one is, do we need more knowledge, or which one, and how to gain it? And to illustrate this, well, we can find a lot of areas where we lack knowledge. Insufficient knowledge, we can define it easily. But sometimes we may wonder even if we have too much knowledge. And for example, on COVID-19, we have nearly 300,000 papers published since 2 years. And so this is even more than a single person can read. So we may wonder if this is too much to be used on the field then. And so do we still need some knowledge, and which one, and how to generate it? And the second question was how to use knowledge in the field, because it must be widely shared. And so we know that the transmission potential of threats is related to individual decisions. And so how to disseminate knowledge and in such a way that everybody and the stakeholders and the decision makers use it on the right way.
I'll take over. We have, with a quick introduction of our three speakers, we have three panelists, and really what they have in common is their broad knowledge across multiple disciplines: ecology, disease emergence, human-animal interface, antimicrobial resistance, food safety. We have Serge Morand. He's an ecologist, he specializes in health and disease ecology, and he's studied and published extensively on the link between biodiversity and disease emergence and antimicrobial resistance. He's based in Bangkok and is part of the OLEP expert panel. Dr. Abela-Ridder, Bernadette, works in Geneva at the WHO, and she leads the work on One Health, and zoonoses at the Department of Control of Neglected Tropical Diseases. And she works closely with the FAO and the OIE, together with the WHO, to advance common areas of work on zoonoses, food safety, other risks emerging at the human and animal ecosystem interface once again. We're happy to welcome Dr. Teresa Shapiro. Dr. Shapiro is an ecologist with multiple interests in wildlife ecology, diseases, and One Health. And in particular, she's a specialist of bats. Her Twitter account is the Bat Girl. She graduated from Harvard University, and she's got a PhD in interdisciplinary ecology from the University of Florida. She's now a postdoctoral fellow at the University of the Negev in Israel, where she uses network ecology approaches to study plasmid transmission potential and zoonotic viruses. And recently, as a member of the IUCN Bat Specialist Group, she's participated on the work on SARS-CoV-2 transmission between bats and humans. And so I would like to open this forum with a very quick roundtable and ask each of you to summarize in 1 minute, it's a challenge, your key message on the topic we're addressing. Where are the knowledge gaps? And I would like to start with Julie. Julie, can you tell us how your research contributes to filling these knowledge gaps? And what are your key messages? So you have a little more because you haven't spoken before. You have 2 minutes.
I think as a wildlife ecologist, I feel like one of our biggest gaps is understanding the specific context and interactions that lead to spillover or emergence of infectious agents, especially because there can be long time delays. What happens in the world today, we might not actually see the effects of it for years to come. And so sometimes putting those together can be really difficult. You know, for bats, we know that they have so many different viruses, but the majority of them, the vast majority of them, will probably never actually spill over or affect humans or our domestic animal species. But understanding the specific context where that could happen also requires understanding the life history and ecology of those wildlife host species. And for many of them, we actually have a really limited understanding of many of those aspects. And then, of course, there's also the gap in how to interface effectively between different disciplines, people working in different areas, and then, of course, implementing our knowledge. I think Bernadette actually gave us a lot of really great examples that sometimes we actually do have a really good idea of what we need to do or what should be done, but finding the political will and the resources to actually implement that can sometimes be the greatest challenge.
Thank you, Julie. Serge, what's your take on the question and your key message?
Yes, thank you very much. And first, I would like to say that I'm very happy to meet Julie. And first, a message just to give a big hello to my friends and colleagues from Ben-Gurion University, and especially the Boehringer campus. I miss this. I was there 2 years and a half now, and I miss you to come back there. Anyway, go back to the knowledge. I completely agree with Julie, and this is the problem when we are scientists. When we are scientists, we want always more knowledge, more things. We are working with this. We are putting questions, we're getting knowledge, but every kind of knowledge we receive, we ask new questions and we want new knowledge. So maybe the most important is, and I will tell you a little bit about a new important program that are asking by the European Commission to the program Eclipse, is to address a request about biodiversity in the post-COVID cross-sectoral challenges. This is a European Commission, and we are starting the process to put the request into actions, and really contact Eclipse to go into the process. And we work with all the DGs on this, especially the DGs Health, Santé, the DG Trade, and the DG Environment. But what is important actually is really the policy relevant knowledge. This is important. So that's why we need to work on the request for knowledge with the with the stakeholders, with the recipients of this knowledge. So if we want to put the One Health into action, we have to work, for example, in Europe, the European Commission, with the DG responsible for santé, for trade, for environment. We need to work with them, and we need to work with the scientists to actually to put the knowledge in a way that it could be easy to understand, easy to manipulate, and easy to be put into action by the relevant policymakers. Actually, it's the same with OLEP, with WHO, OIF, and the tripartite plus UNEP. It's the same things. They ask us to put some knowledge into the way that it can help the tripartite plus UNEP. So I think this is the way. And as a scientist, actually, it's very interesting because it puts us also to ask the questions and to find the knowledge that can fulfill the gaps that are policy relevant for the implementation of the One Health.
Thank you, Serge. Bernadette, what do you have to add to these?
Yeah, I don't want to repeat what my honorable colleagues have already said. It's a great pleasure to be on this panel with such high-level experts. And so I'd like to add, we have many of the tools. We have loads of tools. Where we often are not as good is how to use those tools. How do we translate the knowledge that is generated? How do we scale it up? How do we sustain it from a project into program? I think these are areas where we need to think a little bit more on filling those gaps. And often it has something to do with data. What is the data we need? Where can we link it to make it more powerful? I mean, we have modeling, for example, but modeling is really there to fill the gaps. If we could do a better job at the data, we'll need less modeling and need less prediction because we'd have the actual hard data. So I think also that we need advocacy. We need to be mobilizing, and this is happening right now. As I said in my talk, often we need a crisis to mobilize attention for something that doesn't seem so important at the onset, but we can use the tripartite and UNEP to build that advocacy. You use other partners to build the advocacy, to mobilize governments and other partners based on the best evidence that we have. And I like what Serge brought up around looking at the economic aspects, looking at the social behavioral aspects. It's so multifaceted, but the more we are informed, and I guess this is where we need implementation, operational research, in order to understand the research in the context of different environments. Yeah, so a few thoughts from me there.
Thank you, Bernadette. And I will then start with a question for Julie to illustrate the topic of multidisciplinarity and how to make different fields work together. Julie, your background is in ecology and specifically bat ecology, but you were recruited to work on antimicrobial resistance in the hospital context. So that's quite a jump from one field to another. Can you explain where this collaboration came from and how it worked?
Sure. That was my first postdoc after finishing my PhD, and it was on a project that was led by Dr. Jean-Philippe Razigade at Syrie and the Hospice Civil de Lyon. And they were looking for someone who could work on an ecological perspective of antibiotic resistance, but in the hospital environment. And so this was a kind of different perspective on resistance, because when we talk about kind of the ecology of resistance, a lot of times we're talking more about antimicrobial resistance on farms or in water or soils, for example. And so looking at the hospital as an environment as well was a different perspective. And for me, this was super interesting. And so the goal was to understand how this hospital environment and in a system of different hospital wards leads to the spread and the prevalence of resistant infections. And as I was looking at the project and looking at our data, it reminded me a lot of the ecological concept of metapopulations. When we have lots of small populations in different habitats, and in each of those small habitat patches, the population can be very unstable. So a species can disappear, go locally extinct, or reappear. But because we have many different habitat patches that are connected by the movement of individuals of the species, the population as a whole is able to persist. And so we adapted this idea, this framework to the hospital and kind of reimagined the hospital as a network of interconnected patches that had different levels of quality based on antibiotic use and that were connected by the transfer of patients between them. And so by using this perspective, we were able to get some particular insights. For example, understanding the really important role that connectivity between wards seemed to play for particular types of bacteria, such as those that are really hospital endemic and highly resistant, like Pseudomonas aeruginosa or Enterococcus faecium. And so by taking this ecological idea, which is actually meant to help conserve populations, but we wanted to use it, then we kind of flipped it around to see how we can actually reduce resistance and understand where connectivity is causing more infections to occur, and therefore where infection control and, for example, screening for particular pathogens might be an effective strategy to reduce resistance.
Thank you very much, Julie. So another way of looking at the patients and hospitals. We had a few questions from the audience, and we are beginning with these ones because it's important first to well understand what has been said in the talk. And first, we have a question for Serge, because facing the changes you have exposed concerning the acceleration of farming in particular, there are consequences on health and on ecology. And do we know whether it's instantaneous effect or delayed effect, considering the time that is needed to reach systemic equilibrium? Is there some inertia in the system? And are there any consequences?
This is a very good question. Actually, I did not. Yes, no, good question. Good question. I cannot reply now because I should have to gather a little bit in the literature, but for sure that it could be longer. When I think, for example, we have to work a little bit on to gather more data on the past crisis, the sanitary crisis that are affecting the livestock and the poultry. This is really important, and most of the time we forgot this. Because we go from crisis to crisis, we put some new rules, new way, for example, biosecurity or biosurveillance to increase, because it was really put because of the crisis, but we forgot exactly most of what have been done during, especially what Julie already said about the changing in the genes, the changing of the population, the susceptibility, also the way we manage, or also of course for the microbes on the environment that have been built up because of the biosecurity, for example, which has a very big impact. This is something that we really need. We really need to compare actually several kinds of farming, small scale farming, especially also in the place where we want, because of the pressure of the market, because of the pressure also of the people, on the environment. So go back, for example, to a more what we name eco-pastoralism, so to put back the livestock into the field and not to be completely in the farm. This would be quite interesting to know what's going on. Because I'm suspecting that we will decrease the level of infectious disease, but increase the level of parasitic disease, which is completely different, which may have a completely different effect. And we can really compare in this way. So we need science actually to follow up this changing, because we are in some way, especially in tropical region, mostly industrial farming that are still going on and growing up, especially we discussed already before with the African swine fever, but we have some other with the avian flu or some other problem with this increasing farming. But in some other place, especially in Europe, we are on the way potentially to go back, because the decrease of the market, the meat market, the changing of the consumers, the problem also of the environment, and this we will have really some follow-up. And we need really people like Julie to work on the ecology of disease in this case, the evolution of the parasite and the microbes. And we can reply to these questions.
Mm-hmm. Thank you. We also had a few questions on a key point, which is economic aspects and constraints of these knowledge gaps, because this is really driving many points today, and especially for Bernadette, one person asked whether World Health Organization programs have evaluated or quantified the added values of One Health approach for the control of infectious diseases, and if it may help to have an economic approach of that. I don't know, Bernadette, maybe this is more.
So if you want me to go first, I guess we have evaluated small projects, programs as in One Health, but no extensive programs. I also would like to see how it's worked in countries that have, for example, looked into putting a joint One Health unit. Does that work better? Does it not? Supraministerial, does that work better? Does it put more administrative barriers and more signatures to be signed and slows things down? So I haven't seen a thorough assessment. And yes, this is an area, I think, and perhaps Serge could bring this up also at the OLEP as one of the areas to look into, a true assessment. But I am not really aware of a full-scale One Health program around anywhere in the world. We have pilot projects, but that's it. We do not have programs. I'm not talking about projects which have a start and an end date. I'm looking at programs embedded in systems that are of long duration. We don't have them. I have a question now back to Serge, because we work on elimination and eradication of some of the parasitic diseases. And I just wonder whether, and I've read a little bit as well about this, whether this also tips the balance in ecosystems. And when we start to eradicate, then we're doing something else that might not be so good.
Completely agree. And we have now some evidence that the eradication is could have some worse effect, and especially with the ailment and with the parasite and this parasite that are friends or old friends sometimes. And it's something that we learn also from the ecology and the evolution, which we name immunoecology. So we're looking at immunity as a part also of the life history traits. And what we learn when we work, I used to work on rodents like this, and also a little bit on fish. And what we learn about this is that most of the best way the population and finally the individuals and after the selection works is not by going to the resistance, so to the improving resistance, so to eliminate completely, but to tolerance, to better tolerate. And it is something that is quite interesting. So rather than to eradicate, which is sometimes impossible, which is sometimes have some indirect or bad effect. For example, the ailments, we know that if we remove the ailments, it can have some impact on the microbiota, and with the impact on this microbiota, even with the relationship with the virome, it can have a really, through the immune system, quite a bad effect in terms of the starting of non-communicable disease. So parasitome is part also of the microbiome on the virome, and it's part also of your ecosystems, human ecosystems. So we have to understand this. We are manipulating, and the way that we eliminate, and most of the time is also the way also that, like for the antibiotics, all of these biocides, we know that also we favor the resistance. So we have to use them in the best way, like the antibiotics. They are the tools, like any kinds of drugs. I would like the pesticide, like the herbicides. We need to use them carefully. We need to really manage this very well. And we need to learn, again, the lesson from the ecology of the evolution, that the eradication or the tentative of eradication may be not the best way of management. Tolerance can be a way. Tolerance doesn't mean that we have to leave the people that are highly infected. We need to balance, we need to reduce the burden. And just to finish, what quite interesting things, because Bernadette, it reminds me when I was writing on a book, and I read an anthropologist, a health anthropologist, working in deworming population in Africa. And they did not understand, there was a project with WHO, and they did not understand why the local population refused the deworming. And they asked, and they work with the anthropologists and discuss with the local population. And they say that, no, and they know, everybody knows, they know the worms, every country, every culture know the worms. They have a name for the roundworm, for the flatworm, they know this. And they say that, no, they are part of us, they are part of my body. I don't want them to be ripped off. I live with them, they are part of me. But they understand that it's not good for the very young children to have this. So they have a way also, traditional medicine, that we need to wait to get your worm, but the worm is part of you. So they recognize actually by some, I don't know this kind of knowledge, we have to ask for the anthropologist to explain us, but they recognize a very important point. They are part of our own ecosystem, or microbiome and parasitome. This is some lesson that we can learn.
Okay, thank you. We have other questions. So I go to a question that is a bit related to that point on some way of cultural approach of the situation. Because science talks about data to be collected and integrated and modeled in scenarios. But we know that scientific data is dependent on the social political context, on the history of the scientist himself. And so it's a point of view at a given moment. So it may be important to question ethics and sociological aspects of research, and even in some things like mathematical models, how to integrate this this reflection that this is only a point of view from a starting point. I don't know. Maybe if Serge can answer the question, but possibly Julie and Bernadette can have ideas also.
I can start, but sure that Bernadette and Julie will have a lot of things to do about the data. And as a scientist, data is a way also, whatever it could be, also the data that are quantitative, but also the qualitative data for the social science, for example, is important. Qualitative data is important. This is also a link with some ethical aspect, because these data are gathering with of course, with some funders, but also with some connection. We have to think that we own this data, how this data can be shared or not shared, and how they can be useful as much as possible. This is one thing. But after looking at these data, there is also what discussed also Bernadette was modeling and the scenarios on everything that has been done. And there is also some responsibility. So there is some ethics, but there is also the responsibilities. how we can manage some data. We know we have to precise how the data has been obtained, what are the potential bias associated with the data. We have to be open. This is really important, to be open in terms of getting the data. Not only to have the open data, which is what people ask. Sometimes we cannot open the data that concerning individual humans. This data cannot be shared. This is protected, but we can use this data. They can be aggregated, but we have to be transparent about how the data have been collected, in what manners, and maybe someone can find there is some biases. And after we make all the time modeling, we make all the time some kinds of projection, even with a simple statistical regression analysis is already a model, is already with several assumptions behind this. And we have also the way to present for all of the people the responsibilities to present this, to explain, to do this, and the impact of the studies. So this is the responsibility of the scientists. What will be the impact of my research? And what I learned thanks to work with the people from the public health now for several years, which I didn't know before. But when we're starting an ethical committee in Thailand, for example, where I used to work and do these ethical committees, first you have to have the community engagement before to start to have the individual ethical and to have your access and your consent. But into the community engagement, like a work to ethics, also your ethics, you have to show that how your project could really not harm, so make some benefits, but potentially could harm not only the individuals, but could harm the communities. And this is, for me, was really opening my mind. So saying that it's the first time in my life that actually I have to explain, or I have to think how my work, my study could harm a community. And this is something that we learn thanks to the ethical committees, especially in the public health.
Thank you. I think that Julie wanted to ask a question maybe, or complete the answer.
Oh, yeah, I was, for Bernadette, I was just thinking about kind of these challenges of projects versus programs. And I think there's sort of parallels in both like the public health and implementation and also in science, where you always have to come up with a new idea and something that's completely different than before, even if you maybe haven't quite finished the thing that you already started. And like to be able to get funding and do anything at all, you kind of have to promise the world and everything that, you know, you propose a project that, you know, if everything works well, might take 10 years, but you promise you'll do it in like 3 or 4 years. And I was wondering maybe if there's ways to incentivize more long-term thinking, but I think maybe one of the challenges is sometimes also because funders want something that's new and shiny and innovative and not just a simple scaling up of something or a continuation of an ongoing project.
You know, can I answer that without? Yes. Okay. So a lovely question, you know, and I struggle with this, Julie, myself. So I think we have also got a role to influence funders, right? This is why WHO, for example, publishes research agendas. Research not for research's sake and just a publication as an outcome, but research for public health impact. So we have blueprints, we have research agendas, and each guideline that we produce, we also highlight the gaps and highlight what are those areas of research that would be essential to fill those gaps. And I think these are really very important sort of pointers for funders, and they do look at them. So also from the tripartite side, and the UNEP coming on board, generating these research agendas that have been assembled through listening to the needs, to gathering those gaps, and to then target our partners towards filling those gaps. So I think that's really, really important, and that we should focus not only as our final outcome a publication in the Lancet. That's lovely. It's great. It's a way of disseminating, but really to take it to that next step of translating that research into the actual public health or veterinary public health or One Health, and look at the impact. What is the impact we are seeking, and really try to work towards measuring that impact at the end. It's not always easy, but it is possible. Thank you. Hope it answers something.
Thank you.
I will now switch to a question, and it goes back to what Serge just said prior. Communication. It's good to have knowledge, but it's also important that we communicate it well, and so that you can translate into actions. So I'll ask the three speakers if you have determinants that are good or bad practices for how to communicate knowledge, and also who should do it. Do we need other professions? Do we need help to improve the way we communicate science to decision makers and to the public?
Who do you want us to go first?
Well, the one who asks first, so it's you, Bernadette.
Yes, go on, Bernadette.
So what works in South Africa might not work in Pakistan. What is the backdrop? What is the cultural backdrop? What are the attitudes? Again, I'll bring up rabies. What is the attitude to dogs? In South Africa, very different from Tanzania, very different from Pakistan, very different from Latin America. So I think one of the things is really looking at the backdrop on the communications, and to be able to adapt the generic, those global sort of messages, so that we assure that there is uptake, and that we don't communicate only from top down, but really are generating knowledge also at the ground root level, and improving our knowledge, and embellishing it. Science and on the ground knowledge together makes it much more. So you brought up behavioral changes, really important to bring in the social anthropology aspect. I think we have tools, but we haven't always been able to implement them. And then ownership. If we don't have ownership, if we don't have a demand, then there won't, we can't go there and force our goods. I think there's a lot to do there. And then, of course, being open to new findings and trying to embed them and see whether they work elsewhere. And this was brought up before, evaluation, assessment of different communication methodologies in order to see what works in which contexts, and what can we learn from one aspect to another, but how can we then create a custom communication kit, so to speak. I will say one thing, we prepare a lot of guidelines on standard operating procedures and very, very evidence-based documents, but often where we run short is where the dissemination plan. So we have a great guideline, but nobody's using it. And this is where we really need to increase our attention, is to see how do we get that guideline that contains the best evidence for an intervention and for the best impact for, let's say, treatment of people. How do we get it out, adapt it in the context of the users of that endemic country, and assure that it's taken up and that the workforce is then also trained and capable. So it's not just a one-off throw out a brochure. It's a long-term investment in training and workforce capacity building and behavioral change. Thank you.
Yeah. Thank you, Bernadette. Maybe I'll pass the floor to Julie, and specifically asked the question because we discussed it prior to this roundtable. Also, do you have ideas on who should be in charge of that? Who should? Should that be a dedicated responsibility?
I think that as scientists we should be involved, but we should remember that we don't have to do it alone. I think that it's important to communicate our research, and there's a lot of different ways we can do it. There's a lot of scientists, for example, I also use my Twitter account a lot. I don't have enough, I can't fill it up with research, but it also provides a way that I can break down what I'm doing and the results and kind of take home messages in really clear language. And I think that's something that that we can all do and that comes with practice. I think that we can also engage with more professional science communicators. I think it's become like kind of a burgeoning, kind of a new career option of people who are really dedicated to just the good communication of science, and many people who have like really advanced training and experience, masters and PhDs as well, who also really understand the science. And I think whenever we want to, I think one of the things that can be tempting when it comes to communicating with the public or sharing our results is sometimes kind of overstating or overselling some of them. And sometimes we aren't doing that personally, but when it comes to like press releases and materials that we ourselves might not be writing, that can be a big problem and often leads to exaggeration in the press later, because a lot of their information is coming from press releases and not necessarily digging into the nitty-gritty of the articles. And I just wanted to add as well that I think, especially in this conference on kind of One Health and a lot of wildlife disease, is we should also be communicating in a clear way that doesn't have negative impacts on wildlife conservation and that stokes unnecessary fear, because we've seen that's been a really big problem during the whole COVID-19 pandemic. For example, there's been people around the world very far from Southeast Asia who are like scared that they'll get COVID from bats because there's a bat, it has a bat origin, or bats are a reservoir, when they're just where a certain species or a small number of species are the ancestral reservoir, the reservoir of the ancestor of COVID, but you can't get COVID from bats. You just get it from other people. And so being really clear in our communication and kind of providing that extra context or definition without getting too bogged down in the details. So not necessarily saying, bats are the hosts of all emerging infectious diseases. SARS-like coronaviruses are found in rhinolophid bats, or we might find Nipah in pteropodid bats that live in Southeast Asia. And so we have to remember kind of the general level of expertise, because we're kind of so into, we know our systems and our research so well, but sometimes we also have to take a step back and provide that extra context if we're talking to the public.
Yeah, thank you, Julie.
Can I just add something, Pascal? I'm sorry for interrupting. Can I just quickly add something?
Quickly, because we want Serge to have an opportunity to do the question as well. And we're going to short on time on the end there.
Okay, go Bernadette. Go Bernadette. Yeah.
Okay, so first of all, I just want to say who's responsible. I think there's an unused capacity where we could have more reach if we use the different stakeholder groups to actually also be communicating from the different angles, right? There's so many different angles we can communicate from. So we could be increasing our reach there. There is also a risk in One Health that everybody wants to do everything at the same time. That's not possible. And I think we also need to be communicating that, there is also some priority setting within that One Health thing, because we'll scare away any policy person if we're going to try to say, okay, we have to do this and this and this and this all at the same time. It costs too much money. It's just too confusing, lots of coordination. So also to keep it simple and also prioritize within that large complexity. Thank you.
Thank you, Bernadette. And I'll leave the final say to Serge.
Okay, just quickly, thank you very much. Thank you, Bernadette, for your last last mentioned, very important. And also a jump on what you say that is really also, I would say, socio-environmental context specific. So it's really like this. And that's why also that now I'm stuck to work now for 10 years this year with the local community. So actually very close to this place. We work with these local communities for 10 years. At the very beginning, I was interested only as rodents and rodent-borne disease. I didn't care of people. I was really interested on this. And finally, we built up, and we work more on what more interesting by humans. I found finally the humans quite interesting animals, nice, talkative, not so cute as the rodents. And now I'm starting to work on bats. Bats also are quite cute, not so cute as rodents, but it's okay. But what is important, what we describe now with this, because I'm an ecologist working on biodiversity, but in the biodiversity I didn't know. We're starting to work with people as a hunter. I finally tracking rodents. I'm a hunter, not a very good hunter, but there's local hunters, and we work together. They train me. Sometimes I succeed, so they were quite amazed. But we use them, and we're starting to work with compare the traditional ecological knowledge with the scientific ecological knowledge. We base on this, and finally continue to work on this. By this way, we work a lot on finally on the health of everybody, on the health of this. And this is also the way that to build something is to build also to confront knowledge, visions that are completely different between the different stakeholders. So if we put, and I did that, a network of people that are interacting with our project, is the local head of the villager, the local primary care units, this kind of animals, this kind of researchers, all of these as this network of interactive human and non-humans. So we describe this, but we need also to learn the knowledge. I try to understand the knowledge of the animals because I'm working a little bit on behavior and including also the knowledge of domestic animals. We put collars on dogs to follow the dogs and to follow the dogs with the owners in the field. But we try also to see there are several knowledge of scientific, knowledge of lay people, knowledge of administrative. We need to share this knowledge. We don't have the same vision. We don't have the same ethics. We need also to share this way. And it is a way that we can, if we listen to other people, if we get the vision of the other people, yes, we can implement better. Of course, locally, that we have to redo that in several other places, but we can succeed what Bernadette and Julie were talking and were asking.
Thank you so much, guys. We ended up on a very local note when we started on a very global perspective. So we've covered all the bases, and we could continue this roundtable for another hour.
Absolutely, I'm sure, because you've got a lot of patience, all of you. It was a bright roundtable, very motivating and so much interesting. So thank you very much for participating and for all these views and comments on this very important topic. Unfortunately, as you said, we have to continue because the day is rich, still rich and important to us. But really, thanks again to all of you.